This is a right clavicle. This is the acromial end. This is the sternal end. And you know that it's a right clavicle by pointing the rough portion of the bone inferior and having the sternal end facing in towards your sternum. This is the posterior view of a right scapula. This is the superior border, the superior angle, the medial border, the inferior angle, the lateral border, the acromion process, the glenoid fossa, the spine, the supraspinous fossa, the infraspinous fossa. Then you have the coracoid process, the suprascapular notch, and the subscapular fossa. This is a right humerus. This is the head, the anatomical neck, the surgical neck, the greater tubercle, the lesser tubercle, the bicipital groove, the deltoid tuberosity, the lateral epicondyle, the medial epicondyle, the capitulum, the trochlea, the radial fossa, the coronoid fossa, and the olecranon fossa. This is a right radius. This is the head. This is the neck. This is the radial tuberosity and the styloid process. This is a right ulna. This is the olecranon. This is the trochlear notch. This is the coronoid process. This is the radial notch. This is the head. And this is the styloid process. This is a right hand. Starting with the carpals, you have the scaphoid, lunate, triquetral, pisiform, the trapezium, the trapezoid, the capitate, and the hamate. And then moving to the metacarpals, you start metacarpal 1 as the thumb, 2, 3, 4, and 5. And then the digits 2 through 5 have proximal, middle, and distal phalanges, and the thumb only has a proximal and distal phalange. Looking at the carpals on their own, you have the scaphoid, which is resembling of an S shape. You have the hamate, which looks like a hammer, and you have the pisiform, which looks like a P. This is a right hip bone. This is the anterior inferior iliac spine, the anterior superior iliac spine, the iliac crest, the posterior superior iliac spine, the posterior inferior iliac spine, the greater sciatic notch, the ischial spine, the lesser sciatic notch, the ischial tuberosity, the ischial ramus, the inferior ramus, the pubic symphysis, the superior ramus, the obturator foramen, the acetabulum, and the iliac fossa. This is a right femur. This is the head. This is the neck. This is the greater trochanter, the lesser trochanter, the intertrochanteric line, the intertrochanteric crest, the gluteal tuberosity, the linea aspera, the lateral epicondyle, the medial epicondyle, the lateral condyle, the medial condyle, the patellar surface, and the intercondylar fossa. This is a right patella, this is the base, and this is the apex. And you can tell that it's a right patella when you set it down with the apex pointing away from you, it leans to the right. This is a right tibia. This is the medial condyle. This is the lateral condyle. This is the intercondylar eminence. This is the tibial tuberosity, the anterior crest, and the medial malleolus. This is a fibula. This is the head. This is the neck, the shaft, and the lateral malleolus. This is a right foot. Looking at the tarsals, you have the calcaneus, the talus, the cuboid, the navicular, and then you have the three cuneiforms, the medial cuneiform, the intermediate cuneiform, and the lateral cuneiform. And then you have the metatarsals, and they are numbered from 1, 2, 3, 4, and 5. Then you have the phalanges. 2 through 5 have proximal, middle, and distal phalanges, and 1 has a proximal and distal phalange. Then you have the lateral longitudinal arch of the foot, the medial longitudinal arch, the transverse arch. Then looking at the loose tarsal bones, you have the calcaneus, the talus, and the navicular.